And Jane, no surprise really that those rising coronavirus cases, rising hospital admissions too, really dominated Prime Minister's questions with lots of people raising the issues of local restrictions, whether they're working, and of course the backdrop to this too, that Nicola Sturgeon, First Minister of Scotland, is about to announce tighter restrictions there. Let's discuss all of that. I'm joined from Labour by Tan Desai, from the SNP by Kirstin Oswald, and for the Conservatives by Miriam Cates. Let's start first, though, with Keir Starmer, who had this question to put to the Prime Minister.
Today is 100 days, Mr. Speaker, since the first local restrictions were introduced. 20 local areas in England have been under restrictions for 2 months. Prime Minister, in 19 of those 20 areas, the infection rates have gone up. In Rosendale and Hyndburn, they've gone up tenfold. Yet all the Prime Minister has to say is it's too early to say if restrictions are working. But it's obvious that something's gone wrong here. So what's the Prime Minister going to do about it?
Well, Mr. Speaker, as he knows, we're continuing to provide support, £5 billion of support for the North West and North East, for the lockdowns, the extra restrictions that they're experiencing, and we will continue to support all areas across the country that have to go into local measures. Now, 2 weeks ago, I set out that strategy. I said that we would go forward with both national measures and such as intensifying the rule of six, making sure that we enforced the rule of six. 2 weeks ago, Mr. Speaker, he supported it. In fact, I think he went on the Nick Ferrari show saying that, yeah, I support the rule of six. Yes, I do. Yet last night, Mr. Speaker, the Labour Party abstained on the rule of six. He asks what we're doing to enforce. He asked what we're doing to enforce local measures. He can't even be bothered to get his own side to support them himself.
So let's discuss all of that. And Tan, if I can start with you. Sir Keir Starmer there clearly has complaints about what's been going on. It's unclear, though, isn't it? Are Labour now not in favour of the rule of six or not in favour of that 10 o'clock curfew in England? It's unclear whether actually your party is rowing back on your support for these measures.
Vicky, I think first the thing to mention is that almost 50,000 people were not traced, so they were going about their business blissfully unaware that they had or they could potentially have the virus. And I think that is part of the problem that there has been with the system. The government has been slow from the get-go, and in terms of the test and trace system, we were promised a world-beating system. Instead, we have the utter shambles, and as was pointed out, as was quoted, it is an intergalactic level of incompetence. Now, in terms of the government measures, we have said from the get-go that we are in favour of supporting the government. We do not want to be running a parallel system. We want that support to be there so that we get behind the government guidance for the national interest. But unfortunately, Vicky, what we also have is a lack of evidence. So we have continually been asking that in terms of the 10 p.m. curfew, where is the scientific evidence behind that? And in terms of the rule of six, we have been in support of that. So I don't think that the government can accuse us of not being supportive. But we are there to hold the government to account, and we will continue to do that, despite the likes of the Health Secretary not even answering basic questions. I asked him a basic question last week about the testing centre in Slough, and instead he went about trying to wag his finger around and accuse the likes of me of using divisive language and not answering questions.
Miriam, it's right, isn't it, that if MPs from any party think that the system's not working or they see problems, that they should be able to raise those. Do you think the government is providing enough scientific backing, evidence for the measures being brought in?
Well, it is right for MPs from all parties to raise issues where they see problems or perhaps errors with what the government's doing. And Sir Keir Starmer is the leader of Her Majesty's opposition. It is his job to provide opposition and challenge. But I think it's not the job of Sir Keir or the Labour Party to try and destroy confidence in a system that is actually largely working. And it is true, 16,000 positive test cases didn't have their contacts traced over the course of a week. That is an error. It is being looked at. It is being fixed. But we need to put that in the context of a testing capacity that's now 300,000 a day, 15,000 a day around about positive tests. This is an error that needs fixing, but the context is it's a very small percentage of the testing that we're doing. And so the Prime Minister's absolutely right to say that while that data can't be ignored, it wasn't enough to change our strategy. And if you look at other countries around the world in Europe, we are doing as much as, and in many cases, much more testing than those countries. So it is right that we have confidence in this system. We can't say it's perfect. No scientific endeavour happens without bumps in the road. And it is the role of the opposition to point out those bumps. But it's not their role to destroy confidence in something that is by and large working and people should have confidence in.
Well, Kirsten, in a few minutes, we're expecting to hear from the First Minister of Scotland and likely to be further restrictions for you. How is it working in Scotland? I mean, there have been some tighter restrictions brought in, but actually, and in many cases, coronavirus cases are still going up.
I think that it's a complex picture everywhere across the world, and certainly Scotland is not any different in that regard. But I think some things are certainly different. It's, I think, very helpful and very welcome to the population in Scotland that the First Minister every day appears in front of them and lets them know what is happening, why it's happening, which I think is absolutely critical because it's a very challenging time for all of us. It's a challenging time for people in all of our communities, and they do absolutely need to and deserve to understand why restrictions are being put in place and to understand more about the progress of this disease. I can't speak for the First Minister, so I don't know exactly what she's going to say when she speaks to the Scottish Parliament later, but I do know that it will be based upon evidence, and that is the absolutely critical thing, to make sure that all of our actions are focused on the evidence that is there, and to make sure that we then communicate clearly to people what it is that we're doing, why it is that we're doing it. I would also just reflect back on what Tam Desi said at the beginning of the broadcast, because I think it is really important that there is robust processes in place. So the test and trace system that we have in Scotland is working very well. That system is contacting 96% of those who we would want it to, as opposed to 61% for the English system. These things are important. We all need to endeavour, whatever government must endeavour, to try and maximise these systems, because that is one of the key ways that we will be able to make progress against this disease.
And Miriam, isn't that the issue here? There are some of your colleagues, particularly when it comes to the 10 o'clock curfew for pubs and restaurants, who do want to see more evidence. Have you seen any evidence that it works? Some are suggesting it even makes things worse because people all leave at the same time and in many cases get onto public transport.
Well, I think the science behind the spread of coronavirus is fairly well established. It thrives on human contact. The closer we get to each other, the more likely we are to spread it. And I think we all know from a behavioural point of view that it's much harder to obey those rules and to be diligent in following those rules if you've had a lot to drink. And the later the night goes on, the more you are likely to have drunk, and therefore the less likely to follow social distancing. It's not just about a pure scientific point of view of how does this virus spread. We've got to take into account people's behaviour, different culture in different parts of the world, different parts of Europe, which is different, in this country. And I think, as a scientist myself, this is not an experiment that is going on in a lab where there's one variable. It's a machine, a society with literally millions of moving parts, and we have to take into account culture, behaviour, the economy, as well as the science when making those decisions.
And Tam, that's the point here, isn't it? Of course, it's Keir Starmer's job to oppose and to point out where things are going wrong. But it is a very difficult balancing act, isn't it? The government obviously trying to save lives, but also very, very worried about the economic impact. What would Labour do? What are you concerned about in terms of the economy?
Vicky, we have been saying that it's very, very important that we have a roadmap. Months ago, we all agreed that test and trace, that was the best weapon that we have got until we find a vaccine. In the future, obviously, we need to see that roadmap to a vaccine as well. But along the way, it is definitely our job to be holding the government to account, especially when there's a colossal waste of taxpayers' money. A £130 million contract was given to a Conservative Party donor, and unfortunately, those testing kits were not compatible. We had a £150 million plus contract for face masks, which were not suitable for NHS frontline staff. £190 million plus outsourced to a company for the test, trace, and isolate system, which, as I explained earlier, is utterly shambolic. So we cannot have such a huge waste of taxpayer money and for the government not to be held to account. But at the same time, they need to be producing the science. We used to have daily briefings, Vicky, in terms of the scientific officer and the chief medical officer coming out explaining to the nation, this is why it is important that we have this. But now all we've got is bluff and bluster from the Prime Minister. We'd much rather have the scientific evidence so that we can make informed decisions.
Kirsten, just very quickly, has Nicola Sturgeon ruled out a return to a broader lockdown like the one we saw in the spring?
There are some things that we know we're not going to do, but the detail of what is going to be required is still to come. And that will, as we've heard from both of your other panellists, best be done based upon the evidence that Nicola Sturgeon and the Cabinet have in front of them. I think it is critical to also reflect on the fact that we do have medical and scientific advisors performing that public-facing role here in Scotland. So none of these are easy decisions. They're all very difficult. No government in the world will want to be dealing with these kind of really challenging situations. But if we can try and do that by making sure that people are given as much of that information as is absolutely possible, then we will at least be able to make sure that people are clear on why we're asking them to make the sacrifices that we absolutely are appreciative that we're asking people to make.
OK, well, we must leave it there. We will be hearing from Nicola Sturgeon, the First Minister of Scotland, later on this afternoon. But for now, thank you to Tan Dessy for Labour, Kirsten Oswald from the SNP, and Miriam Cates for the Conservatives. And of course, Jane, this is a subject which will be debated a lot more in the coming days.
Goodness.